How do
Mhm.
you see like what's happening with the coronavirus and how it's affecting youth and adults and the decisions that they make for now and the future?
I think for a lot of families, this is a scary time. There's job insecurity, mounting bills, being around the same people day in and day out can all have a negative effect. And I'm sure you've heard that often during times of crisis, domestic violence and child abuse, and especially substance use, all increase. Just because a lot of adults don't have the tools they need to help them successfully navigate those negative feelings.
Yeah, and I'm glad that you talked about substance abuse because that is something that we primarily work on as a team to be able to provide presentations. And so
Hmm.
in 2005, August 2005, Hurricane Katrina hit, and it was one of the most deadliest hurricanes to hit the US. And it really affected that
Hmm.
area huge. And here in Texas, we got a lot of people that came because of that for safety and everything. And so something that they found out is that they found out that more people were smoking cigarettes, consuming alcohol at a higher rate than they were before. And then they also found out that 3 years later, the CDC mentioned how hospitalization rate for substance abuse disorders in Louisiana shot up about more than 35% compared to the year before the storm. And so I mentioned this because I feel like there's something similar happening as the Nielsen research, and so I looked at this up today, is how alcohol
Hmm.
sales have increased substantially from about a year ago. And so it's possible that people are just buying now just because they might be just stuck at home. And so might not,
Right.
but at the same time, it's very similar to where there's a little bit more of an increase. And so I just wanted to hear your thoughts on whether you think there is an going to be an increase or decrease in the youth and adults experimenting with alcohol, drugs, opioids, and tobacco during this time?
Sure. So I see a couple of different sides to this. For adults, I think there's definitely going to be an increase in alcohol in particular. If you think about it, we basically lost our social lives. So it's easy for people to turn to alcohol for entertainment. Likewise, if parents are feeling stressed out, like I mentioned before, they can very easily self medicate with alcohol. Those adults that already have substance use disorders might be likely to turn to more use of their drugs of choice, especially if they don't have to be accountable to a job right now or family outside of their households. And then, particularly if they're struggling with mental health disorders, this could be a time where that use could increase. For kids, I could see it going a couple of different ways. So historically, we know that kids tend to use illegal substances when they're bored. You can bet that most kids across the world are bored right now. The flip side to that is that it's probably likely that most of those kids have some parental supervision right now. Plus, most families are forced into more family time, which we know is the single biggest predictor of youth deciding to not use illegal substances. So my hope with the youth is that some strong family bonds are happening right now, and parents are setting the expectations on their children around their expectation of their substance use.
Great, yeah. And so something I want to talk about is something even before this epidemic hit us, something that was a very hot topic among youth culture was vaping. And something
Hmm.
that happened was before this all happened, there was an episode of Raven's Home that created an episode centered on vaping, mainly because they wanted to share a message to show the youth dangers of vaping and parents an understanding of vaping as well, because sometimes it can be hidden. And so it's a trend I think that is something to be concerned about, especially during this time. By the way, did you see that episode?
I have not seen it. I need to watch it. I'll watch it this weekend.
Yeah, so it's a good episode for kids to watch to definitely learn a little bit more about it with peer pressure, and also they talk a little bit about the dangers of it. But I want to talk
Hmm.
about this because I don't think people realize this: is what are the risks associated with youth and adults' use of drugs, alcohol, and opioids, and tobacco, and just in general?
Sure. So I think the biggest risk to youth with substance use has to do with their growth and development, especially when the brain is concerned. With things like alcohol, the earlier a child starts using alcohol, the more likely they are to become addicted to it. And additionally, if they can put off drinking as long as possible to the age of 26, their brains would be fully developed at that point. So if they're drinking at 11, 12, 14, their brains are not fully developed. And the chance would be that their brain would not develop appropriately from using alcohol. Other drugs can cause issues around overdose and addiction. With increased marijuana use, we're seeing an increase in the lack of motivation and drive in teenagers. We've also seen studies that link lower IQ to marijuana use, as well as poor attention span and memory. Vaping, which you had mentioned, is a big trend among teens right now, and it's having an impact on lung health at a much more rapid pace than traditional tobacco products. For adults, I think that their issues are going to be more around chronic problems. So kidney and liver disorders, lung diseases, heart disease, a variety of cancers. Also, adults with substance use disorders are going to be more likely to suffer from overdose, accidental injury, and attempted suicide. Adding the coronavirus to the mix adds a whole new layer of problems on top of those.
Yeah, and I'm glad that you talked about that, because the fact that we do have a virus that is among us that's very contagious. And I just want to clarify, I'm not a medical expert, I'm not a scientist or a doctor, so I'm not an expert on COVID-19.
Right.
But I feel like we're all still learning new things about it every day. I think that's why we have the precautions that we have right now, because we're still learning about this. This is still very new to everybody. And so, but I have learned that it is very contagious and it is very easy to spread to so many people very quickly, as we can kind of see just in our area and around the whole world. It started in China and now it's everywhere, like all around the world. It doesn't really discriminate. And so, and this is something the CDC identifies as people who are at risk of catching COVID-19 as people who are smokers. And the thing about them catching it is that because smoking does do damage to your lungs, if you were to say catch COVID-19 as well, then what happens is that you can have a lung infection that aggressively attacks our lungs, even lung cells, and also damages the tissue as well. And so that's why and so this was from the Chief Medical Officer, Albert Rizzo, of the American Lung Association, really encouraging people that do smoke to definitely be careful, but also to, is an opportunity to be healthier and to not put yourself in that position, because you are a little bit at higher risk when you do choose to smoke, or even like choose to use substances that can affect your health.
That's right.
Yeah. So I think it's just really interesting how, like, even it seems like it's a separate issue, but it still affects us in all different ways, to where we can still make choices that can help us combat those.
Right.
So what are some habits that can affect one's future? So we talked a little bit about it.
Yeah, so habits can go either way. You can develop good habits right now, or you can develop bad habits right now. So some people might be using this time to slow down and develop new habits that are beneficial to their health, maybe getting a better night's sleep every evening, going on nightly walks or bike rides with their family, enjoying meals together, bonding over games or other activities, catching up with friends digitally. I've had some Zoom meetings with some friends, and of course doing FaceTime with grandparents. But likewise, this could be a time when people could form habits that are going to negatively affect their health, such as drinking in excess every day, overeating, interacting too much with negative TV or social media, not getting enough exercise or social interactions. I think it's just really important that people are mindful about what we're doing and how we're feeling every day, especially right now. And habits can develop relatively quickly, and they can be difficult to break. So we just want to be sure that we're paying attention to what we're doing on a daily basis.
Yeah, and I'm glad that you said that, because I think that we all have good and bad habits that we have developed through our lifetime. And it's hard to change those habits, especially when we have been doing it our whole lives. And so doctors talk about how people with a history of alcohol or substance abuse may be more susceptible to COVID-19 because they are more likely to have a weakened immune system through it. And so, and whenever we think about weakened immune system, that's something of a habit that we create, that we end up creating. And so that's
Right.
why it's really important to be able to choose the best habits for ourselves. I know that none of us are going to be perfect. We're all going to have it. But there are some things that we can definitely control to be able to develop healthy habits. And I think what's also important is also to understand that it's never too late to change. Even if we have made these bad decisions in the past or anything, we can make changes today to help our body and be able to recover. And it can make a really huge positive impact in our lives.
That's exactly right.
And so why is prevention so important during times like these?
I think prevention is more important now than ever, just given the stressful and anxiety filled times that we're in. If we have a strong foundation and resiliency in place, then we can more readily cope with the stressors that we're facing. If you don't have the knowledge of how to handle mental health issues or just days when you just feel off, it's real easy to turn to substances to help fill that void or drown out any negative feelings. If you're feeling that you can cope with what is happening in your life, there are a lot of, if you're not feeling like you can deal with what's happening in your life right now, there's a lot of ways you can reach out to get help. I think our agency website is a good place to start. It's bgcgtc.org. They've done a really fantastic job at putting up resources to help people in these times. So it's a good way to kind of get the ball rolling with finding the help that you might need.
Yeah, definitely. Let me ask you something. So, like, we've talked a lot about like the risks and some of the negative things that are happening in our world right now. I want to be able to provide hope for people during this time because I feel
Mm-hmm.
like there are great opportunities to learn how we can live healthier lives. And so, what are ways we can do that right now? Like, build like better habits. What are some things you would recommend?
I would recommend getting outside. Just going outside in the yard or going for a walk. I know we can't really go to parks right now, but getting fresh air makes a world of difference. Not staying cooped up and tuned into negative feeds constantly, I think is going to help a lot. I know it could be hard to have good eating habits right now, especially if grocery stores are lacking some of the things that we usually want to prepare that are healthy. But it's a good time to maybe cook some things that are a little more nutritious and could provide us more energy. And then I think just taking care of yourself, getting a good night's sleep is important, and reaching out to people that make you feel good about yourself, whether that's friends or family. Picking up the phone and calling can make a big difference.
Yeah, that's something I've noticed a whole lot since all this has happened. As I've been seeing way more people outside ever since,
Hmm.
and people like families walking together, and and if they're not families, they're definitely keeping their distance, and so they're definitely practicing these habits, but they're still like getting exercise. They're going out of their houses and they're being together. And I don't, and most of them aren't even on devices as well. They just want to be outside.
Right.
And that's something like I really didn't see that much before all this happened. I didn't see that many
Hmm.
people outside. I didn't see people really exercising, but people seem to be making that more of a priority right now. And so that's something I hope that we learn from this is that we we develop these habits, and then we don't take like the things that we may have for granted, and just understand how it is good for us to be able to get out and do those kind of things.